So our topic today is the effect of birth control on future fertility, and obviously there's a bit of a determinant of which birth control we're talking about. So birth control pills or oral contraceptives are the most common type of birth control, and they do not have a long-term impact on your future fertility. In fact, women on the pill have lower rates of sexually transmitted disease, so lower risk of tubal infection or tubal disease. They also may have a lower risk lifelong for ovarian cancer. It helps minimize the risk of ovarian cysts and may even be somewhat of a suppressive treatment or help in folks that have endometriosis. So if anything, it may help preserve your fertility, not hasten your infertility going forward. So if you want to be on the pill when you're young, you don't need to feel like that could jeopardize your future ability to have a baby. Iuds are generally safe, but they are a device that's put into the uterus, and there is a risk with Iuds of an infection going from the vagina up into the uterus. And that infection then could spread into the tubes and cause tubal disease, even tubal blockage. So the main risk of an IUD is tubal disease, which could necessitate IVF in the future. Barrier methods, diaphragms, condoms, etc., really don't carry a future risk for infertility. And some of the depot preparations, the implants and the Depo-Provera shots, don't have a long-term risk for infertility, but short-term, it can take a few months after your last treatment with these depot preparations for it to essentially wear off or get out of your body, and during that time, you may not ovulate. So it can take longer for your cycle to resume and ovulation to resume if you've done things like Depo-Provera or the Implanon implant. I hope that helps you understand your options for contraception and how that plays into your future fertility. Thanks.